So chemistry, that is, the sulfonamide was first recognized in the year of 1932, but it is clinically used to treat the bacterial infection in the year of 1935. The first compound found to be effective antibacterial agent in safe dose and ranges. Chemically, it is a molecule containing the sulfonamide or sulfanilamide or SO2NH2 functional group attached to the aniline. See, this is the structure. If you remove this functional group, just it is an aniline. So, in the para position, introduce the sulfanilamide functional group. Sulfanilamide functional group, that is SO2NH2. So basically, sulfonamide consists of sulfanilamide functional groups which is attached with the phenyl ring having the amino functional group. Structurally related to para-amino benzoic acid means sulfanilamide. The structure of sulfanilamide is similar to the structure of para-amino benzoic acid, PABA. That is called PABA. So the sulfonamide having the structural resemblance. Sulfonamide having the structural resemblance, that is with para-amino benzoic acid. With para-amino benzoic acid. You see here, I'm showing. See, this is the structure of sulfanilamide. This is the structure of PABA, para-amino benzoic acid. You see, here amino functional group, here amino functional group. But the difference is there. Here it is sulfanilamide functional group, and here it is carboxyl group. So the sulfanilamide having the structural resemblance with the para-amino benzoic acid. See, now these groups also present in the non-bacterial compounds, like there is some of the sulfonamide drugs which are also used to treat the other disorder which are not treated as an antibacterial agent. Example, sulfonylureas, benzothiazides, furosemide, acetazolamide. Means sulfonylureas are the sulfonamide drug. Benzothiazide, it is an diuretics. Furosemide, diuretics. Acetazolamide, diuretics. But these all drugs consist of the sulfonamide moiety, but they are not used to treat the bacterial infection. They are used to treat other disorder. So here, the basic chemistry of the sulfonamide, it is basically consists of sulfonamide functional group attached with the aniline molecules, and the structure is similar to the para-amino benzoic acid. The other drugs which contain the sulfonamide moiety, they are used to treat the other disorder. Example, sulfonylureas, they are coming under the category of the anti-diabetic drug. Tolbutamide, like this. Benzothiazide, they are coming under the diuretics. Furosemide and acetazolamide, they are also coming under the diuretics. Now going to discuss the SAR of this sulfonamide. You see, we are dividing the complete molecules in different groups. R is a substitutional group, and this is called sulfanilamide functional group. And this is the aromatic nucleus. Or phenyl ring attached with the amine functional group. So the whole structure of the sulfonamide are divided into different pharmacophore. R is the side chain, that is substitution. Different substituent indicated by R. And this is the sulfonamide functional groups. This is the phenyl ring. This is the amine functional group. Now, in SAR, point to be remembered, the amino and sulfonyl group, on the benzene ring are essential for showing the antibacterial activity of sulfonamide moiety. And these two functional groups should be present in the C1 and C4 position of the phenyl ring. The sulfonyl functional group, the sulfonamide functional group should be present in the C1 position, and while the amino functional group present in the 4th position. Then only the sulfonamide derivatives shows its prominent antibacterial activity. So first point to be remember, the amino functional group and the sulfonyl functional groups shows the or essential for the antibacterial activity which are present in 1 and 4 position of the benzene ring. Next, second point, replacement of the aromatic ring. Replacement of the aromatic ring by other ring systems or the introduction of additional substituents or additional substitution on it decrease or abolish the antibacterial activity. Suppose if you replace the aromatic ring by other system means other heterocyclic compounds or cyclic ring, or if you introduce the additional substitution in that side chains C1 and C4, then it will decrease the antibacterial activity of the sulfonamide. Third point, exchange of the sulfonylamide functional group or amide, the exchange, or if you replace the sulfonamide or sulfonylamide functional group with amide functional group, it will reduce the antibacterial activity. It will reduce the antibacterial activity. Remember that a replacement of this sulfonylamide moiety with the amide functional group, it will reduce the antibacterial activity of the sulfonamide. Next point, substitution of aromatic heterocyclic nuclei. Substitution of aromatic heterocyclic nuclei at N yield a highly potent compounds. Means if you substitute the aromatic heterocyclic nuclei at N, means here N1, that means this one. That means if you introduce aromatic heterocyclic nuclei at R position, then it will produce a good sulfonamide derivatives which have the potent antibacterial activity. N1 disubstitution generally leads to inactive. If you introduce 2 times, that means here you see, actually substitution will be happening in the N1 position. See here N, if you introduce as a hydrogen as a R, that is NH2. Now if you introduce the aromatic heterocycles in R, then it will produce a potent compounds. But if you replace this R and this hydrogen, means double substitution, that is double substitution in this N, it will lead to inactivate the compounds. It will lead to inactivate the compounds. So these are the few points to be remembered for the SAR of the sulfonamide derivatives. So the amino functional groups and the sulfonylamide functional groups are essential for the antibacterial activity of the sulfonamide, which are present in the C1 and C4 position of the aromatic ring. The replacement of the aromatic ring by others benzene ring. Here, this replacement of the aromatic ring, that is replacement of the aromatic ring with the other systems or introduction of the substituent in R, it will lead to the antibacterial, it will lead to decrease the antibacterial activity. But if you replace the sulfonamide functional group or sulfonylamide functional group with the amide functional group, it will drastically reduce the antibacterial activity. Substitution of R 1 time with aromatic heterocycles, it will lead to a potent antibacterial agent. But disubstitution at N, disubstitution N, it means if you substitute hydrogen and R, then it will lead to decrease the antibacterial activity of the sulfonamide derivatives. So these are the few points to be remembered for the SAR of the sulfonamide. Next, go for Mechanism of the action of the sulfonamide. Mechanism of the action of sulfonamide. See, hello, Sundray?
Yes, sir.
So what I told that sulfonamide structures are having the similar structure with the para-amino benzoic acid. Para-amino benzoic acid. Remember, that's why I shown that is sulfonamide drugs having the structural similarity with the para-amino benzoic acid. Now I am going to discuss the mechanism of action of the sulfonamide. First of all, we should give the general mechanism of the purine synthesis. Why it is needed? You see, the para-amino benzoic acid react with the pteridine. In case of bacteria, para-amino benzoic acid and pteridine reacts to give the dihydroteroic acid. Dihydroteroic acid. That is pteridine synthetase. Pteridine synthetase is present in the bacteria. That bacterial pteridine synthetase convert the para-amino benzoic acid and pteridine to form a dihydroteroic acid. Dihydroteroic acid. Now, this dihydroteroic acid is converted into dihydrofolic acid. Dihydrofolic acid, DHF. DHFA. Remember, DHFA, dihydrofolic acid, in the presence of the enzyme dihydrofolate synthetase. Dihydrofolate synthetase. Now, this dihydrofolic acid ultimately give to tetrahydrofolic acid. Tetrahydrofolic acid in the presence of dihydrofolate reductase. Dihydrofolate reductase. Basically, tetrahydrofolic acid is responsible for the synthesis of the thymidine, purines, and methionine. Thymidine and purine. Thymidine is a base for the DNA molecules. Base for the formation of the DNA molecules. And purine is a very important base for the DNA molecules. Now, thymidine and purines are the basic components for the formation of the DNA for the bacteria. So DNA is important for the multiplication of the every cell. So bacteria required DNA for the reproduction or for their growing. Now, tetrahydrofolic acid is important for the formation of the DNA of the bacteria. So this is the basic biosynthetic pathway for the formation of tetrahydrofolic acid in the bacteria, which is required or which is an essential component. That means tetrahydrofolic is an essential component for the formation of the bacterial DNA. And methionine is an amino acid. Which is also plays an important role for the metabolic activity of the bacteria. Now, the starting material for the synthesis of the tetrahydrofolic acid is para-amino benzoic acid. Now, para-amino benzoic acid is a primary substrate for the pteridine synthetase. That is bacterial pteridine synthetase. So, para-amino benzoic acid and pteridine both are react with the pteridine synthetase to form the dihydroteroic acid. Now, sulfonamides also have the structural similarity with the para-amino benzoic acid. So, what will happen when you are giving the sulfonamide? The sulfonamide displaces the para-amino benzoic acid from its binding site of pteridine synthetase. That means when sulfonamide you are applying, that sulfonamide displays the para-amino benzoic acid from its binding site of the pteridine synthetase. So instead of PAVA, the sulfonamide bind with the pteridine synthetase, so that instead of dihydroteroic acid, it will form the sulfonamide derivatives. It will form the sulfonamide derivatives. So if there is no formation of the dihydrotelluric acids, ultimately this intermediate dihydrofolic acid or tetrahydrofolic acid are not formed. That is, if dihydrotelluric acid is not formed, so ultimately these two intermediate formation is inhibited. So all these three basic components, thymidine, purines, and methionine will not be formed. So bacterial DNA formation is disrupted drastically. Bacterial DNA is disrupted drastically. So there is no formation of the bacterial DNA, and bacterial growth ultimately inhibited immediately. So thus, sulfonamide having the structural similarity, so it will bind to the pteridine synthetase, thus inhibit the formation of the dihydrotelluric acid, which ultimately lead to disrupt the formation or inhibit the formation of the bacterial DNA molecules. Ultimately, it will lead to the inhibition of the growth of the bacteria. So this is the basic mechanism for the sulfonamide, by which the sulfonamide drugs inhibit the bacterial growth. समझ में आ रहा है? हेलो,
सर।
हाँ बोलो
सर इसमें आपने ग्लूटामेट नहीं बताया।
ग्लूटामेट लास्ट में आएगा। एक मिनट
हाँ कल कर दी उन्हें जमा।
हाँ
आपसे नहीं कह रहा सर, विकास से कह रहा।
किसको?
कर रहा है सर।
हेलो,
क्या कह रहा है? क्या कह रहा है?
क्या कह रहा है?
मैसेज आज कर रहा है।
कौन?
ना कल ही करा है।
यही है, बहुत मक्कार है।
तो याद नहीं।
ये बात यार,
क्या हुआ सर?
एक मिनट
सिर्फ सर एक्टर नीचे सर वो एक्ट्रेस वाले फोटो नहीं आते सर।
हाँ
पहले आते थे अच्छे अच्छे।
ठीक है, बात में
क्या हुआ सर?
नेक्स्ट आई एम गोइंग टू डिस्कस अ न्यू टॉपिक फॉर एंटी फंगल एजेंट। ठीक है
सर, इसको तो करा दो।
हो गया कंप्लीट सर सल्फोनामाइड वाला।
हाँ सल्फोनामाइड यूज
अरे अभी नहीं होगा।
सुनो,
क्या रह गया?
अरे सर स्ट्रक्चर तो बता दो सर इसके।
कौन सा स्ट्रक्चर?
अरे सर इसकी स्ट्रक्चर
नहीं
नहीं
कम आ रही है सर।
अरे स्ट्रक्चर किसका? स्ट्रक्चर तो बोल दिया था। ठीक है, स्टार्ट कर दो।
अरे सर अभी तो आधा घंटा हुआ है।
हाँ सुनो, अभी एंटी फंगल स्टार्ट करता हूँ। ठीक है
सर वो हो गया खत्म।
ठीक है।
हाँ सल्फोनामाइड यूजेस यू
आपने यूज भी नहीं बताया सल्फोनामाइड के।
यूज ही बता दो, थेराप्यूटिक यूज बता दो सर एक दो।
Oh, therapeutic use basically used to treat the actually sulfonamides are used to treat basically different disorder. First, it is used to treat the urinary tract infection, UTI, lower urinary tract infection, prostatitis. Next, some of the sulfonamide drugs are used to treat the that is diabetes, and some of the sulfonamide, sulfonylureas, tolbutamide, glibenclamide. Okay. So glibenclamide and tolbutamide are the sulfonamide drugs which are used to treat the diabetes mellitus. Some of the sulfonamide used to treat as a diuretics, benzothioazide diuretics, loop diuretics, furosemide. Okay. So next acetazolamide. It is
सर
सर ये
बेसिक सा क्वेश्चन बता दो सर।
बोलो।
अबे मैं पहले पूछ लूं, तू पूछ रहा।
नहीं पूछ ले अनिकेत, पहले पूछ।
पूछो, हाँ पूछो।
अरे सर ये अपर और सर लोअर यूरिनरी ट्रैक में कौन कौन से वो आते हैं, थोड़ा सा बता दो, क्लियर कर दो कॉन्सेप्ट।
वो अपर यूरिनरी ट्रैक इन्फेक्शन नथिंग बट इन्फेक्शन ऑफ द किडनी एंड यूरेटर, ठीक है। देखो अपर
ओके सर।
यूरिनरी ट्रैक इन्फेक्शन मींस इन्फेक्शन ऑफ किडनी एंड यूरेटर। लोअर यूरिनरी ट्रैक इन्फेक्शन मींस that is
यूरेथ्रा।
bladder, urethra, prostate, ठीक है। bladder, urethra, prostate. Basically the upper urinary tract infection is treated by basically cephalosporin, ठीक है। cephalosporin, remember, for the most of the cases the upper urinary tract infection is treated by cephalosporin drug, cephalosporin antibiotics. And lower urinary tract infection you can treat it by that is fluoroquinolones, sulfonamides, and fluoroquinolones, sulfonamides and nitrofurantoin. समझ में आया है? बोलो।
सर फर्स्टली ड्रग क्या देंगे, सबसे फर्स्टली प्रेफर क्या करेंगे?
हाँ हाँ,
तो फर्स्ट लाइन ड्रग क्या है? फर्स्ट लाइन थेरेपी पूछ रहा।
तो किस लिए तुम बोलो, कौन सा इन्फेक्शन के लिए मुझे बोलो। अभी तुम यूटीआई,
ओवर यूटीआई।
यूटीआई के लिए सर।
हाँ, lower UTI, first of all, you give the nitrofurantoin. If nitrofurantoin does not work, you go for the fluoroquinolones. Fluoroquinolones, ofloxacin, ciprofloxacin, gedifloxacin, ठीक है। अभी if it is not also respond, then go for sulfonamide. Then go for sulfonamide. Depending upon the that is diagnosis. First of all, you identify the bacteria. Means first you go for bacterial resistant test. Which bacteria resistant to which drugs? Then you can choose. Suppose sometimes if you give ofloxacin, for example, if the infection is caused by Pseudomonas aeruginosa or E. coli, sometimes they will resist nitrofurantoin. For example, if it is Klebsiella, it will resist to ciprofloxacin or other drugs. Then you change the antibiotic. So depending upon the type of bacteria and the resistance to antibiotic, you must choose the antibiotic specific type. Understood? Without
Yes,
without diagnosis, if you go without diagnosis means without diagnosis, suppose there is a bacterial infection, but must you diagnose? You go for the culture of the bacteria. Which type of bacteria causes urinary tract infection, and you identify the resistance of the antibiotic. Then you choose and apply the antibiotic. Understood?
सर कल्चर से पता चल जाता है कि बैक्टीरिया कौन सा किस ड्रग को रेजिस्टेंट कर रहा है।
Yes, exactly. That is called bacterial assay, zone of inhibition, microbiology.
ओके सर, यस सर।
हाँ, अभी 10 मिनट है, फिर 10 मिनट के बाद मैं शुरू करूंगा। यहाँ पे टाइम है, अभी शुरू करता हूँ, ठीक है। समझ में आ रहा है भाई? देखो यूरिनरी ट्रैक्ट इन्फेक्शन, it is caused a variety of bacteria. So first of all, we should identify the bacteria by culture. Then go for the means in culture you can do the urine culture, and you can give the antibiotic. That test will show which type of antibiotic sensitive for which type of bacteria, and which type of antibiotic resistance to which type of bacteria. Then you can easily apply or prescribe the drugs.
सर जब यूरिन एग्जामिनेशन कराते हैं तो सर उससे मतलब डायग्नोस कर सकते हैं कि इसको इन्फेक्शन है या नहीं है यूरिन में?
हाँ, नहीं यूरिन ट्रैक्ट इन्फेक्शन पहले यूरिन का कल्चर करना ही पड़ेगा। यूरिन का कल्चर करना ही पड़ेगा। Without urinary culture we cannot give it. Suppose you have urinary tract infection, you randomly you take the
यूरिन टेस्ट होते हैं उससे सर कंफर्म नहीं हो सकता? यूरिन टेस्ट भी तो होते हैं, यूरिन एग्जामिनेशन वगैरह सर।
ना, यूरिन एग्जामिनेशन यहाँ पे दो टाइप है। वन ऑफ द आरई मींस रूटीन एग्जामिनेशन ऑफ यूरिन। वहाँ पे क्या क्या आएगा? रूटीन एग्जामिनेशन ऑफ यूरिन में आएगा फिजिकल एग्जामिनेशन ऑफ यूरिन और माइक्रोस्कोपिक एग्जामिनेशन ऑफ यूरिन। बट बैक्टीरियल कल्चर इज डिफरेंट, ठीक है। culture test routine RE for urine we can do for the kidney function test or others, but for urinary tract infection we must go for culture of the urine plus RE, routine examination plus culture of urine. समझ में आ रहा है?
Okay sir.
This is there in the biochemistry, not studied. Biochemistry, that is diagnostic LFT, liver function test, renal function test, All this coming under biochemistry.
सर पढ़ी होती तो आपसे क्यों पूछते?
ओए पढ़ी हो तो तुमको खुद पढ़ना यार।
अरे
हाइपोसुल्तानिक है।
अभय कुमार कुछ नहीं, अभय कुमार गुप्ता
यस सर।
कुछ नहीं पूछता है मुझे।
सर अभी तो मैंने तो पूछा था।
अच्छा
थेरापेटिक यूज क्या है सल्फोनामाइड का?
आज थेरापेटिक यूज तो मैं बोल दिया 3-4 यूज और थेरापेटिक यूज में तुमको नोट में दे दूंगा 10-15 यूज है, 10 से ज्यादा ही है, मैं भेज दूंगा ठीक है नोट, वहाँ पे देख लेना थोड़ा।
सर को वीडियो ऑन करके दिखा
पूछा करे यार सर से क्वेश्चन, वीडियो ऑन कर।
और क्या
और पूछो। हाँ और पूछता हूँ मैं,
वीडियो ऑन करके पूछ सर से क्वेश्चन।
पूछो वीडियो ऑन करके, मैं भी वीडियो ऑन करता हूँ।
यस सर।
बोलो।
सर ये पूछ ही नहीं रहा है सर।
अच्छा मुझे बोलो,
बुक का कलेक्शन रखा हुआ है सर।
व्हाट इज द मेजर एडवर्स इफेक्ट ऑफ सल्फोनामाइड? व्हाट इज द मेजर एडवर्स इफेक्ट ऑफ सल्फोनामाइड?
सर फोटोटॉक्सिसिटी।
अरे नहीं यार, मैं बोलता हूँ, you are a pharmacist. Whenever you are giving sulfonamide drug therapy, what you will advise the patient? Tell me.
सर पहले तो उसे क्रिस्टल यूरिया होगा।
हाँ वेरी गुड।
और फिर हीमोलाइसिस भी होगा, एनीमिया होगा, हीमोलाइसिस एनीमिया।
ये छोड़िए मेजर इफेक्ट क्रिस्टल यूरिया, तो क्रिस्टल यूरिया होगा तो अभी तुम पेशेंट को क्या बोलोगे? बिफोर गोइंग टू गिव द सल्फोनामाइड ड्रग थेरापी, देन व्हाट यू विल एडवाइज टू पेशेंट? बोलो भाई।
पानी ज्यादा से ज्यादा पियो।
हाँ कौन बोला है? कौन बोला है? नाम बोलो ना।
सर विकास बोले।
विकास गिरी।
विकास गिरी।
अच्छा वेरी गुड वेरी गुड। हाँ actually if we actually long term sulfonamide it will concentrated in the kidney, that is in the kidney pelvis and major or minor calyx of the kidney, so that sulfonamide crystallize out if there is a less amount of the water. Understood? So if anybody taking the sulfonamide drug therapy, you must tell the patient must be take 4 to 5 liters water per day, so that sulfonamide drug metabolite will be easily solubilized and excreted from the kidney. Otherwise it will form a crystal urea. That crystal urea ultimately lead to renal calculus. Understood?
Yes sir.
This is the major adverse effect for sulfonamide. Next, now I am going to start the antifungal agent. So before going to start the antifungal agent, you know fungus? Abhay Kumar Gupta, bolo. You know fungus?
Yes sir.
Next, fungus. Next, Vikas ki Oniket. Oniket, tum bolo. Oniket bolo fungus. Where they will reside or where they will grow? Fungus. Microbiology. Where they will grow? What is the characteristic feature of the fungus? Jolly ball.
Itching, irritancy.
नहीं मैं बोला where they will reside, where they will grow basically. जो भी सब्जेक्ट ने पूछा बायोकेमिस्ट्री, माइक्रोबायोलॉजी और ह्यूमन एनाटॉमी, फिजियोलॉजी, all subject basic concept is not clear. What I can do? हाँ
सर गाली दे दो तुम सबको।
नहीं गाली नहीं दूंगा। गाली क्यों दूंगा?
सर कुछ पढ़ाई नहीं हमने तो क्या करा?
फंगस बेसिक। अभय कुमार गुप्ता जी
हाइपोसुल्तान जी।
बोलो where fungus basically grow in our body?
सर पूरा बोला करो सर।
हाँ
अभय गुप्ता हाइपोसुल्तान।
बदमाश रे तू विकास गिरी, बोलो ना।
सर पूरा बोला।
मुझे सर इतना ज्यादा तो नहीं पता, बस इतना पता है कि उसकी जो सेल वॉल होती है ना वो इर्गोस्ट्रॉल की बनी होती
अरे
है।
ये नहीं, मैं बोल रहा हूँ क्वायर। एक्चुअली बेसिकली द बेसिक concept is fungus, they are growing in the moisture place, moisture area. Where there is a moisture, the fungus will be grow there only, and they also reside in the rootant, or that means जहाँ पे कास्ट्रा और मीन्स वेरी डर्टी एरिया, वहां पे ही दे ग्रो करेगा। तो हम लोग का बॉडी में क्या होता है, हम लोग का बॉडी में द फंगस इज बेसिकली ग्रो इन द ह्यूमन बीइंग इन द पेरिनियल रीजन, इन द पेरिनियल रीजन, एक्सिलरी रीजन। Do you know perineal region, axillary region? Now I am not going to discuss the anatomy.
Yes, sir.
Ah,
Yes, sir. Yes, sir.
yes, fungus are basically grow in the perineal region and axillary region of the human body, as that place are always reside in moisture due to secretion of the sweat. Understood?
Yes,
Basically,
sir.
fungus growing is basically happen in case of in summer season, no? Anyway, the fungal infection is called what? If there is a fungal infection, what does it mean? Fungal infection is called as what? Have you heard the name of mycosis? Mycosis.
Yes, sir.
What does it mean?
Mucormycosis is a fungal infection.
Huh?
Mucormycosis is a fungal infection.
Mucormycosis is recently come. You tell me what is mycosis? Mucormycosis is recently you have heard them. Mycosis. Mycosis how many types? Mycosis how many types? Anybody?
I don't know.
Pradeep Kumar, Priyanshi join. Dinesh Kumar. How many types of fungal infection? This is fungus protozoa bacteria. You studied details in the microbiology, but you don't know the fungal infection. Fungal infection are basically two types. One is called superficial mycosis. Second is called deep mycosis. Superficial mycosis and deep mycosis. Superficial mycosis means when the fungus infect the surface of the skin. When the fungus infect the surface of the skin is called superficial mycosis. Superficial mycosis. Example, ringworm. Have you heard the name of ringworm?
Yes, sir.
This is called superficial mycosis. And deep mycosis means candidiasis. Candidiasis, basically it will infect the vagina or scrotum of the testes. They will enter into the deep layer of the skin and infect the